takes 2 years to heal a doctor. That's my estimate based on witnessing over 1,000 fellows who have gone through the fellowship in integrative medicine. I'm the executive director of the University of Arizona Center for Integrative Medicine. We developed a fellowship in integrative medicine that began on site in 1997, but since 2000, we have been teaching it online. I want to tell you that the narrative, when the fellows come in for their residential weeks, there are 3 of them, one at the beginning, one at the middle, and one at the end, is remarkably consistent. During the first residential week, fellows talk about how burned out they are, about their thoughts of leaving medicine. Some of them are just 1 to 2 years out of residency, and they're horrified to find themselves burned out already. Others have been in practice for decades. I keep refilling prescriptions. No one gets better. They come back every 3 months, said one. A psychiatrist said, "We take care of people with severe mental illness. They see us 4 times a year for 15 minutes each time. Is this what we can offer? 1 hour a year to people with mental health challenges? This is not what they came to medicine to do or to feel." The second residential week, 11 months later, fellows have begun to live the recommendations that they're making to their patients. They've made marked changes in their personal or professional lives. Some 5 to 10 out of the 70 will have taken new jobs. Others have changed their diets, begun to meditate, committed to regular exercise. Similarly, they're making changes in the ways they take care of their patients. They regularly recommend an anti-inflammatory diet. They teach breathing exercises. And they explore their patients' beliefs and values. They're gradually weaving in to their patient care what they're learning, patient after patient. And they've started to feel lighter, happier, more aligned with their sense of vocation. Graduation takes place at the end of the 3rd residential week. Fellows speak of being transformed, of being more present during patient care, of appreciating their patients' points of views. One said, "I am more aware of the healing process within the patient." Another, "I feel humbled to have the privilege of participating in this majestic process of healing." A third, "I have fallen back in love with the practice of medicine and feel a real sense of purpose." I know their journey, the pain, the discouragement, the burnout. I experienced it too. I worked for a large California HMO, and sometime in the 1990s, I found myself unable to tolerate the treadmill of medicine. After some soul searching, I decided to leave, but I wasn't sure if I would ever practice medicine again. And then I learned about the University of Arizona's fellowship, its brand new fellowship in integrative medicine, and I moved my entire family to Tucson. Gradually, I found myself restored. I felt healed, and I love the work I do now, taking care of patients and teaching health professionals new ways to care for themselves as they care for their patients. It's not just me. Some 45% of primary care doctors are burned out. So what leads to the healing? I can point to a number of factors. Connecting with others who hold similar beliefs and the ability to be vulnerable with one another. modeling another way of practicing medicine, and creating a safe space where people can talk about what has been lost and can be regained. What is so deeply meaningful to witness class after class is the restored sense of calling that these physicians experience. What is it that called you to medicine? Is it still quickening within you? If not, what would it take for you to heal? Can you take a first step? What might that be? I honor the courage that it takes to do so. Thank you.